folks, Elizabeth here, postural alignment specialist. Try to say that a few times. Postural alignment specialist. I'm here to talk about back pain because back pain is super common. It's just such a common type of pain that we all experience from time to time. And I'm going to talk about 3 types of back pain and the postural deviations that are probably involved and the muscles that are involved. So the first type of back pain that I'm going to talk about is chronic off and on mid to low back pain. So chronic, that means going on for long periods of time. Off and on means episodic. So maybe it hurts at night or it hurts on the weekends, but it's been going on for a while. So chronic, off and on, mid to low back pain. And the muscles involved are erector spinae. Actually, that's spinae. I've been trying to get this right. Erector spinae. And they are the long, skinny muscles that go up and down the spine, and they basically just nicely surround the spine and keep us upright, okay? So the problem is when we have a postural deviation, a common one like kyphosis, which is the excessive kyphosis, which is the extra C curve in that upper back, okay? So that's excessive kyphosis, that's the hunched over look, and generally our shoulders come forward and our head is also forward. So when that happens, you can imagine if we've got these little muscles up and down that are meant to kind of go up, pretty much upright, and then they're having to bend over and which lengthens them, and they're having to now hold up a head that weighs much more than its usual weight. Heads weigh about 10 pounds, but if you send it off the gravity line forward like that, it's going to weigh a lot more to the things that are holding it up, basically. Okay, so that means that erector spinae are stressed. They're lengthened, they're probably weakened, and they're basically stressed and not functioning optimally. And the reason, sometimes it could be like, for instance, maybe your upper back hurts at night. So maybe that's because during the day you're sitting, and sitting exacerbates the deviation. Probably, right? If we're a little hunched over and then we're sitting and doing something that's down here, it exacerbates it. So by the end of the day into the evening, that's when the muscles have been stressed out more than usual all day long, and then so they hurt at night. Or maybe, for example, doing lots of activity on the weekend, even running. So I've noticed that runners, oftentimes, especially if they're already a little hunched over, will really get hunched over to try to kind of get themselves moving forward with the upper body. Take a look at yourself if you're a runner, or watch the next runner you see. So often, it's as if we're trying to get ourselves down the road with our upper body, and it has nothing to do with our upper bodies at all. It's simply the engine of the hips moving us along. So a little refresher on proper alignment and our proper joint alignment, which is proper postural alignment, has to do with all of our load joints, okay? So it's the ankles, and just directly above that should be the knee joints. And then directly above those knee joints should be the hip joints, which would show up about there if you're in the side view. And then directly above that, shoulder joint, okay? So it's looking like that. And then kind of like the middle of your ear is what'll be in line if you keep going up. So when we start to head out of that line, in other words, our upper body is moving forward, all kinds of things happen. And runners, I've noticed, because if you're that's what I was going to say. So if next time you do some kind of activity, if you're running or even walking, try to keep the shoulders floating above the hip joint. Okay, this is a great exercise, and it feels really good. And it really should feel like your shoulders and your head are kind of floating above the rest of your body. And when you see runners, they're often doing this, right? They've even got their head down like they're trying to get forward, and it's just so not good for our bodies, and it's not the way we're supposed to move through life. So that's the first one. Second one, acute unilateral low back pain. Okay, acute unilateral low back pain. So acute means intense and short term, and unilateral is on one side, and we're talking about low back pain. So it's like, ouch, right? We injure ourselves. We strain ourselves in our one side of our lower back. And in this example, I'm going to use the quadratus lumborum as the muscles that are involved, also called the QL. And I'm going to show them to you real quick. They're really strong little muscles right up on either side. They start right at the hip bones, kind of in that general area, and they end up right along the rib, the lower rib there. And they're really strong muscles. They're easy to palpate. You can really feel them. And in my article, I talk about actually rotating and noticing what those muscles have to do when you rotate, because that's the postural deviation that I'm talking about, which is like that's a shoulder rotation, and then hip rotation would in either direction, you know, just kind of off that flat plane. So what happens? You could do it. You could palpate the quadratus lumborum, and then turn your shoulders one direction or the other. Okay, and you'll notice that everything changes in that musculature. There's a twisting that goes on in the QL. There's one of them is shortening, okay, and one of them is having to lengthen. And rotation is very common. I mean, a lot of us just walk around rotated. One of our shoulders is, for example, always forward. So that's that one. Third one, chronic, constant, mid-upper back pain. So these are just some examples, and these are just some key muscles that would be involved. And it's, again, just showing you how posture is just very related to back pain. So chronic means all the time or for a long period of time. Constant is actually all the time, like all day long, all night long. Mid upper back pain. So this is so common. This is maybe even the most common. I was a massage therapist for a long time too. The most common pain or complaint that I hear is the pain up here. Muscles involved, rhomboids. Okay, and interestingly enough, this is my favorite one because it really shows how the body's all connected. The postural deviations that I'm going to use as an example here is lordosis, which is the excessive lower back curve. So if you were to stick your butt up and back, that little lower back has to curve more. That's lordosis. So we're talking about excessive lordosis, and we're talking about a pelvic tilt, which I have to show you. So this is the pelvis. Mine's pretty neutral, and if I were to go that way with it, that would be anterior, and this is a posterior tilt. You'll see that a lot too. That's somebody they kind of lose their butt, and that's quite common too. But in this case, we're talking about an anterior tilt, and you can see that immediately it does change the C curve. So it increases this lordotic curve. So that is the deviation. Anterior tilt, lordotic curve. Now, did you see what my shoulders are doing? This is what's kind of amazing, I think. Those are my dogs, sorry. If this is a good video, I'm not changing it. I'm leaving them barking. So watch what happens. Like, here's my neutral spine, right? But I'm going to send it anteriorly, and I'm going to increase that curve. Watch this. See what my shoulders just did? And if you look again, they squeeze together. That's what happens. Okay, so that squeezing together of those shoulder blades, that's the rhomboids. So somebody with hips and a lower back that's doing that all day long, which is very common, ends up keeping the shoulders tight and the rhomboids clenched. So there you go. That's posture, that's pain, that's muscles involved. It's really all related. And when you're talking about posture, you're talking about the muscles, because it's the muscles that move the bones. So that's why the Egoscue method strictly brings the muscles back into alignment, which brings the whole musculoskeletal system back into alignment. So I sure hope that made sense, and thanks for watching.